Whether it's been from food poisoning or a bad bout of indigestion, we've all had a bellyache that's kept us in for the night. But imagine if that one night of pain and canceled plans was your normal. Instead of having to deal with it for a few hours, it's a constant presence looming over your life. For many, that's how it feels to have inflammatory bowel disease. It's an umbrella term for chronic conditions that have an excruciating effect on the gastrointestinal tract. Most people with IBD are diagnosed by age 30. But David Merritt was ahead of the curve when his symptoms started in college.
I noticed there was some issues when I was going to the restroom, and I didn't know what was going on. I just know that there was blood, and that scared me. I thought, maybe that's cancer or something. I didn't know. After it didn't go away for a couple of weeks, I then decided to talk to my parents about it. I said, well, why don't we take you to see a doctor? And I remember actually a doctor at Northwestern Medicine diagnosed me, Dr. Nimagata. And very quickly I was able to go into remission.
IBD is a cycle of flares and remission. Merritt was able to stop his first flare-up about a month after it started, but the disease can change at a drop of a hat. Dr. Kate Tomasino says the most common forms of inflammatory bowel disease are Crohn's disease and ulcerative colitis.
So ulcerative colitis is limited to the colon, while Crohn's disease can affect any part of the GI tract. But the hallmark symptoms when you're thinking of inflammatory bowel disease and what it's like to live with that are things like urgency and diarrhea, feeling like you have to get to the bathroom right away and the stool being looser, frequency of bowel movements, abdominal pain, potentially sometimes for some people there could be weight loss associated with that. Fatigue can be a big symptom. So depending on if a person has Crohn's disease or ulcerative colitis, and then where it is in the GI tract and how severe it is, will really impact how the person is experiencing the condition.
Tomasino is a clinical health psychologist and associate professor of medicine and psychiatry at Northwestern University. She says that while stress isn't causing the disease, it can play a huge role in triggering a flare. For Merritt, stress and a bad order of sushi spurred his second flare-up that felt like having a daily dose of food poisoning.
You feel tethered to the bathroom. You're afraid to go out. You feel, weak and you're hungry, but you also don't want to eat, right? Like all of those horrible feelings, everyone knows them because everyone's had food poisoning at least once. Well, take that feeling and expand it across weeks and months and years. And then take all of the ways that that impacts you for a day and think about the wearing effect it has on you over time. When you don't know what you can eat or what you can't eat because you don't know what's safe or what's going to make you sick.
And the right answer is always changing. You become afraid of small outings like going to the movies because you don't want to be the person interrupting the film every time you have to go to the bathroom.
There's a lot of inconveniences or impediments in your everyday life. And then there's a lot of social stigma to it as well. No one wants to be talked about for going to the bathroom. And so those really add up to be a lot of burden. And you don't even realize how much they eat at you until they're gone, until you're in remission. And I remember that feeling in 2019 when I'd been in a flare for 4.5 years. I'd been hospitalized at some point in there. It had been miserable. And by the time we figured out a medication to pull me out of that flare and get me healthy again, I was amazed. I hadn't even realized how much in my life I'd lost and how much my disease had overtaken the big and the small things in my life.
Though the flares are hard to control, Tomasino says that IBD can be a tremendous toll on your quality of life, even when in remission. As Merritt mentioned, this constant struggle can wreak havoc on your mental health.
In the whole group of people with IBD, there are higher rates of depression and anxiety, and then trauma related to the medical condition itself. So people can have post-traumatic stress from some of the medical things that they've been through with IBD.
Tomasino says that part of this trend comes from the inflammation. It predisposes patients to higher rates of depression. And though Merritt has been able to stay positive through this experience, he's dealt with brief impacts on his mental health at different times in his journey. While on a work trip in 2023, Merritt became violently sick. 2 weeks later and finally back home, he couldn't even get out of bed.
I was spending hours in the bathroom a day, and I ended up having to be hospitalized for 3 weeks in an incredible amount of pain, and it wasn't really clear what was going to happen to me. It was a very scary experience. I was so afraid of what might happen to me that my heart rate was racing. And I literally remember they were taking my blood pressure one day, and the doctor walked in and my blood pressure shot up 20 to 30 points just because I was so afraid of what news the doctor might bring. And I loved my doctors. I thought my doctors were fantastic. I feel I owe my life to them, but I was afraid.
Recovering from this experience was the first time Merritt realized he couldn't be two separate people. There could no longer be the flare version and the remission version because his actions in one state had profound impacts on the other. Merritt says it's helped him manage his IBD much better than before.
So even though I've been in a mini flare over the last few weeks, it hasn't felt like my life is that different because I have learned how to better manage both the physical and the mental side of the disease.
In addition to medication and recognizing his triggers, Merritt's tried hypnosis as a tool to help manage the disease. Tomasino believes that the mental aspect plays a huge role in the patient's quality of life, so figuring out how to manage that element can drastically improve the overall experience.
Feeling depressed and feeling anxious is not comfortable. It impacts quality of life in a tremendous way. It can limit ability to engage successfully in the treatments that people need to do for IBD. But then also, hopefully, we're helping with whatever inflammatory effect that depression, anxiety, and stress might have that could potentially exacerbate the condition, decrease length of remission, get people hospitalized sooner, or increase risk of surgery. And we've seen all of those effects in the literature that if you leave this stuff untreated, that people can have worse outcomes in inflammatory bowel disease.
As Tomasino mentioned, depression and anxiety can cause patients to fall off their treatment plan, which opens them up for a relapse. Taking medication every day or making doctor's appointments can become difficult tasks when depression has sucked away all your motivation. To combat this, Northwestern's Behavioral Medicine for Digestive Health program is launching a screening program to recognize and treat mental health concerns with IBD patients. Tomasino, a co-director of the program, says it's important to treat these as separate conditions and not make patients feel as though they're at fault for their health challenges.
This is an inflammatory condition. This is not anything that's in anyone's head. We really have to make sure that we're careful around thinking about this and talking about depression and anxiety in IBD because people can take a lot of blame on themselves as though somehow this caused the condition or stress caused the condition. And that is absolutely not true. But we know that stress can cause inflammation and depression can be associated with inflammation.
They're hoping to normalize the conversation around mental health, especially since this population is more likely to develop depression and anxiety. The program is being funded by parents of a young man who took his own life in 2024 after a long battle with IBD. Tomasino hopes the new screening protocol helps remove some of the stigma felt by so many patients and connects them with others in the community.
I think it's really important to note that this is never anyone's fault and that it isn't in your head. If you're having these mental health symptoms on top of IBD, it's not just like you're not able to take it or manage it. I think a lot of times people have a lot of self-blame, but there's something inherent in the condition that is increasing the likelihood that someone will experience depression or anxiety related to the condition. So the more we normalize this and talk about it and help people get help when they need it, the better people will be able to manage it and feel compassion for themselves as opposed to like they're doing something wrong.
And since these are two separate conditions, Tomasino says patients most likely need more than one treatment approach. Merritt has found success using both medication and mindfulness tactics. So even though he's currently experiencing a small flare-up, he already knows the best way to get back to healthy.
I'm very fortunate where I'm on a medication now that my body really responds to. A lot of people aren't that lucky and they spend a lot of time cycling between medications, but I found one that works really well for me. So we just increased my dosage from 30 milligrams to 45 milligrams, and my body started to respond very, very quickly. Otherwise, I would say really a focus on mindfulness and other just positive forms of taking care of yourself. Prioritizing reading a book or going for a walk or getting a workout in, things that make you feel good, whatever that might be. That's really important for reducing the stress that can only make your condition worse.
In addition to stress management and medication, Merritt's realized just how important the IBD community is as a support system. During his hospitalization, a friend reached out and offered to connect him with other people who'd undergone surgery for IBD.
And I said that would be great because I was at that point on the verge of like a mental breakdown. I mean, I was so stressed in the hospital bed about what might happen to me. She put me in touch and they cleared their schedules to talk to me next day. And we talked, for the days after that, and we would check in on each other. And all of a sudden, right, these people I didn't know and who had no reason to care about me were there to support me and spend hours on the phone with me to help me understand and make the best decision that I could.
The Crohn's and Colitis Foundation has chapters across the country that provide support groups and other resources for patients with IBD. You can find more information about Dr. Kate Tomasino, David Merritt, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.